Uh, at the behest, I would like to thank the organizers, Dr. Rishi, Dr. Hema Pant, and the scientific chairperson, Dr. Kandari. I see he's not here right now, for giving me the topic and the opportunity to speak here today on the topic vitamin C, the topical therapy in dermatology. I guess there's some problem.
Slides, please. And also, speakers, you have 10 minutes, so please honor the time to maintain
So
our
I'll try my
honorable
level
presence.
best. The topic is extensive a bit. So topical vitamin C therapy, fact versus fiction. When I was asked to speak on this topic, I thought that I think that it is more of a fiction, but by the time I read about the topic and when I interacted with the dermatologists all across the country, so my views change and hope that yours change too. So fact or fiction, see what C can and cannot do for you. Vitamin C, throughout history, women have always found ways to enjoy the anti-aging effects of vitamin C. In Tibet, during the Tang dynasty, women who wanted to fight the outward signs of premature aging would rub sea buckthorn on their face and hands. The golden orange berries of the sea buckthorn plant yield deep colored oil that is a major source of vitamin C. And now we see many products that come into the market contain the same sea buckthorn. So the commonly used vitamin C for treating the aged skin, hyperpigmentation and various other skin conditions. The formulations vary by their pH, packaging and vehicle, which may decrease absorption and therefore the efficacy of the product. So nowadays, as a Prime Minister speaks his Man Ki Baat, and we live in Delhi where everything is done through surveys, so I thought that why not conduct a survey of the dermatologists all across the country, and I was able to find results from 74 of them. When we asked them that do you use vitamin C serum in your clinical practice, 81% of them, that's 60 out of the 74 that replied my questionnaire, said that yes, they do. By the molecule when they were using, but they were using for various things. So when we went to the PubMed and in the literature, various studies that were published there about the topical L-ascorbic acid percutaneous absorption studies, and the objective of the study was to define formulation characteristics for delivering L-ascorbic acid into the skin to supplement the skin's natural antioxidant reservoir. In the methods used were that the L-ascorbic acid or its derivatives were applied to pig skin. Skin levels of the same were measured to determine the percutaneous delivery, and they found out that the pH levels less than 3.5 was required to enter the skin. Optimal percutaneous absorption was maximum when it was 20%, and saturated after 3 daily applications. The half-life of the tissue disappearance was about 4 days. So delivery into the skin is critically dependent on formulation characteristics, so which formulation you are using, and that's what is going to deliver. Another study for ex vivo cutaneous absorption assessment of stabilized ascorbic acid and formulation using a microdialysis system found that ascorbic acid penetrates rapidly after topical application. The persistent reservoir of ascorbic acid provides an important and attractive photoprotection strategy. A single-blinded comparative study between the use of glycolic acid 70%, I don't know most of us whether they use 70% glycolic acid or not, and the use of topical nanosome vitamin C iontophoresis in the treatment of melasma. Now, the objective of this study was to evaluate the efficacy and safety of nanosome vitamin C iontophoresis and to compare the therapeutic effects of the same versus glycolic acid peel of 70% concentration in the treatment of melasma in Egyptian women. They used 14 patients of melasma with skin type 4 to 5 were taken for right-left comparison study of 6 sessions. Glycolic acid 70% peel was applied on the right side, whereas nanosome vitamin C was applied by iontophoresis on the left side. The results were evaluated using the melasma area and severity index score and with photographs at baseline and after 6 sessions. Also, the photographs were evaluated by 2 single-blinded physicians before and after sessions, and what they found out was that both sides improved, but the side treated with nanosome vitamin C showed better results. So they concluded that nanosome vitamin C is a new, safe and effective, easy and painless method in the treatment of melasma. So you have something else compared to a glycolic acid 70% peel too. Another study for the treatment of melasma with mixed parameters of 1064 nanometer Q-switch Nd:YAG laser toning and an enhanced effect of ultrasonic application of vitamin C. A split phase study found that when evaluating the improvement of melasma using different parameters with 1064 nanometer Q-switch Nd:YAG laser with ultrasonic application of topical vitamin C, most of the melasma cases were dermal and mixed type melasma. The entire face of each patient was treated with 1064 nanometer Q-switch Nd:YAG laser for 4 sessions at 1 month interval. Right side of the face received ultrasonic melasma application of vitamin C for 15 minutes after ice packing, and the left side was covered with a moisturizing lotion. The objective evaluation was performed with visual analog score, showed significant improvement with ultrasonic application of vitamin C compared to laser monotherapy. The improvement was more pronounced during 2nd to 4th sessions, so you require repeated sessions. No rebound or post-inflammatory hyperpigmentation detected during the 3-month follow-up period. And the combination of the Q-switch Nd:YAG laser and treatment with ultrasonic application of topical vitamin C exerted more prompt response of melasma. So you can add up with all your procedures vitamin C to give better results. Topical vitamin C, a useful agent for treating photoaging and other dermatological conditions. That's another study that was published. The article reviews the scientific data and clinical studies supporting the use of topically applied vitamin C for treating photoaged skin, and they found that the vitamin C promotes collagen synthesis, photoprotection from ultraviolet A and B, it helps in lightening hyperpigmentation and improvement of a variety of inflammatory dermatoses. Because of the diverse biological effects of this compound, topical vitamin C has become a useful part of the dermatologist's armamentarium. So what are the facts of vitamin C? The first fact is applying vitamin C to the skin is 20 times more effective than oral ingestion. Applying vitamin C daily for 3 days can achieve optimal levels in the skin. And once the topical antioxidant is absorbed into the skin, it cannot be washed out or rubbed off. Even after stopping applications, significant amounts of vitamin C will remain in the skin for up to 3 days. So what makes topical vitamin C preparations so important? Humans and few other species lack the ability to produce the vitamin C. While oral supplementation with the vitamin is important for maintaining one's overall health, it is not very effective at increasing skin concentration of the vitamin. The most effective method for replenishing the vitamin in the skin is therefore to go straight to the source and apply it directly to the skin. So, but why topical C? The L-ascorbic acid is chemically active form of the vitamin. The LLA is biologically active and thus useful in medical practice. Bioavailability of the vitamin in the skin is inadequate when it is administered orally. The use of topical ascorbic acid is therefore favored in dermatology. So it's an antioxidant. When the skin is exposed to UV light, ROS such as superoxide, iron peroxide and singlet oxygens are generated. Vitamin C protects the skin from them and has an antioxidant effect. Exposure to the UV light reduces the availability of vitamin C, and that's the reason why the patients should be asked to apply it after exposure to the sunlight. Vitamin C also directly activates the transportation of collagen synthesis and stabilizes pro-collagen messenger RNA, thereby regulating collagen synthesis. Signs and symptoms of scurvy, a deficiency disease of vitamin C, are due to impaired collagen synthesis. Talking about depigmenting agent, where it is used most of the time in our practice, it is important to differentiate between the substances that are toxic to the melanocyte and substances that interrupt the key steps of melanogenesis. Vitamin C falls into the latter category of depigmenting agents. Vitamin C interacts with copper ions at the tyrosinase activase site and inhibits action of the enzyme tyrosinase, thereby decreasing the melanin formation. It does have some anti-inflammatory effects also. It inflicts the NF-kappa B, which is responsible for the activation of a number of pro-inflammatory cytokines. Therefore, vitamin C has a potential anti-inflammatory activity and can be used in conditions like acne vulgaris and rosacea too. Topical formulations of vitamin C, there are various facts. Only serum contains active vitamin C in an almost colorless form. It is unstable and an exposure to light gets oxidized to dehydroascorbic acid, which imparts it a yellow color. So if you are prescribing something that's yellow in color or the patient is using it, it's of no use. The stability is controlled by maintaining...
Please conclude, Rohit.
Sir, just 2 slides. The half-life in the skin after achieving maximum concentration is 4 days. A persistent reservoir of vitamin C is important for adequate photoprotection. So a regular 8-hour application is necessary. As UV light lowers tissue vitamin C, so it should be best used after exposure to UV light and not prior. So serums are a clear-cut the winner when it comes to gel serums, roll-ons and whatever you get in the market, powders, etc. And that's what has been practiced throughout the country. So when they were asked that whether a topical vitamin C in dermatology really works, is it a fact or a fiction? Most of the dermatologists all throughout the country say it's a fact now. So could this be the fountain of youth? That's, I think, yes, you can add it in your practice to give better results along with what all procedures you do. So when it comes to vitamins, I guess it's the dermatologist's best bet to go with vitamin C. Thank you.
Thank you, Rohit. Maybe we can take 2 short questions. Quick ones, yeah.
Thank you, Rohit, for that talk. What is your take on the so many derivatives of vitamin C that we get? Sodium ascorbyl, magnesium ascorbyl, ethyl ascorbic acid, ascorbyl 2-glucoside, so on and so forth. Because as far as I know, we should use L-ascorbic acid.
Yes.
And stability is an issue.
Yes. So every time a new company comes to you, they say that they have come up with a new product and they have stabilized the molecule even better. But most of the data when you show it talks about L-ascorbic acid, and it should be the pH 3.5 that it says it should be used on a normal skin. If it's a dry skin, you have to have a higher pH, otherwise it can cause irritation. So these molecules, when they talk about, they say that okay, it's not going to irritate, it can be used on all sort of skin, even dry. But if you are having a dry skin, a patient is having a dry skin, you can go for some vitamin C preparation that is liposomal. Otherwise, L-ascorbic acid is your best bet.
Can I just make a comment here?
So you will conclude what?
Yeah, I will just conclude what I thought. So as far as I know, that all these preparations, the derivatives, they have good, the permeability is questionable,
yes.
A, and they do not get converted to L-ascorbic acid. So I think their use is questionable. And the pH should be less than the pKa of ascorbic acid in all preparations. That's when you should use it. That's what
new things that are coming, they have a pH of 5 or 5.5, and they say that okay, it's a better product because it doesn't cause any irritation on the skin. That's why they are coming up with all new formulations. But whatever data is available and what really works is the L-ascorbic acid.
Last.
Yeah, just is it necessary it should be applied only at night?
Ma'am, that's what the studies say, that because if you expose it to sun, the efficacy is going to decrease. That's the reason it should be applied at night.
No, but what I'm asking you is that if it's applied in the day, is it that it's not effective? If you apply it in the day,
if you're not moving out, if there is no UV exposure, then it's fine. You can apply. But that's what data says, that it's better to apply at night because at least the efficacy of the product,
so
if at all it is there. Yeah.
That I agree. But in the day, would the
It can be
efficacy
applied. We apply when patients come to us in our clinical practice and we are doing a procedure after a microdermabrasion or a laser. We do apply vitamin C.